It is a dual narrative, the overwhelming increase in cases, but also that phase 1A of the vaccinations.
Yeah, the vaccine is spreading quickly across the state. Raj Mathai is tracking the Bay Area distribution and the warning from a Stanford professor. Raj.
Janelle, Jessica, this is just day one of what's expected to be about a 6-month-long process. Here's what we're seeing in the past 12 hours. A lot of emotion, a lot of hope, and some straight talk about the new concerns. Let's start this evening in the Bay Area's most populous county. The first vaccines arrived in Santa Clara County, 5,800 doses. This is part of the initial 17,000 doses being allocated in the South Bay. This is now being distributed to various hospitals. Also, the county's top doctor giving her final COVID update of 2020. This comes to the Board of Supervisors. Dr. Sarah Cody, who has been among the most proactive health leaders in the country, got emotional today.
We have lost 553 people in our county. COVID, in fact, is on track to be among the 5 leading causes of death here in our county. So our pandemic locally is out of control.
The weight of this pandemic getting to all of us. We do have this, a smile and actually a little bit of a fist pump you'll see in the East Bay. Couple hours ago, the first doses were administered at the Contra Costa Regional Medical Center in Martinez. The thinking is here among health experts that this vaccine distribution will be much more fair and accessible than the COVID testing process.
I think one of the things that is disturbing was the way in which COVID testing was rolled out, which I think from a justice point of view was an unmitigated disaster. It was not centralized. It was not a rationalized process. There was pretty much a free-for-all, a lot of commercialization, because a lot of this involved home-based laboratory-developed tests. There wound up being a lot less control over it, and the result of that was that sports teams got it. There were times when healthcare workers were unable to get tested and results in a timely way, who were exposing themselves to COVID and having symptoms at a time when their local athletic teams were being tested multiple times a week. So it's just hugely problematic how testing rolled out. We can't have a repeat of that experience with vaccines, and fortunately we are not going to have a repeat of that experience. It's a much more rational.
Stanford professor David Magnus there, a prominent biomedical ethicist. He adds that we are likely to see a black market when it comes to the various vaccines. Jessica, Janelle, we'll see you later on in this newscast.
And that could be a very dangerous predicament. All right, thank you, Raj.